introduction and to give me opportunity to talk in the FM 2022. My talk is on the quantitative analysis in nuclear medicine, that how the nuclear medicine helps in the quantification and what is the role. So, nuclear medicine playing a very important role to diagnose the disease and to know the response of the therapy. And these are the quantitative indices which can be extracted by nuclear medicine. That is count, relative quantification from count ratio, activity concentration, percentage injected activity, functional and metabolic activity volume, that is relative cardiac function, brain metabolism, and standard uptake rate. That I will explain one by one. Why the quantification is needed in the nuclear medicine and what is the importance of it. It aids the accuracy of the reporting, that is disease versus no disease, allows the objective analysis of severity of disease and therapy response, helps the inexperienced reader by providing additional adjunct to visual analysis. Quantification can be affected by multiple factors, and understanding of these is crucial in order to avoid misinterpretation. These are the factors which can affect the quantification in the nuclear medicine. Patient factor, physical factor, and technical factor. So first I will talk about what are the things which can be used for the quantification in the nuclear medicine. In planetary single photon imaging, the number of photons detected by a scintillation camera as falling inside the defined acceptance energy window at a position corresponding to a pixel in the image termed as a tau. And in non-imaging probe, just like a sentinel probe, measurement a counter which is attached with a probe, and some of the number of photons detected in a time interval. Example are to obtain the cumulative activity in the sentinel nodes and dosimetric studies to obtain the cumulative activity over a time period. The number of counts in a certain area in the image is calculated for a region of interest, that is for region ROI or volume of interest defined by the user. ROI in a single image ratio for some ROI can be used to detect differences in the activity of play. An example is some activity between the left and right kidney. ROI over time from the study can be important in addressing the viability of a particular organ or a tissue. Activity. So now I will explain this activity. What is the activity? Activity is measure of number of nuclear transposition occurring per unit of time. The unit of activity is the vector defined as one transition per second. The order technique, order unit, which is Curie, is in the common use. The goal of quantitative nuclear medicine is to determine the absolute activity in a given volume, for example, patient and organ or a tumor per unit volume, that is vector pyramid, by external measurement of the radiation emitted by a CPS metavector can be used to convert a number of counts into an activity.
Kiruka ji, Dr. Kiruka?
Yes. Yes.
Hello, sir?
Yes. Yes.
Somehow we are not able to hear it properly. I think your voice has some problem.
Now you can, my voice is
audible, but it is not clear.
So I will, maybe this is the issue of this, net. I will try. Value, now it is coming?
It is better. It is better than before.
Yeah. Value regardless of location of the ROI in the image. Activity concentration, that is, this is the activity concentration. The activity in a source in air can be accurately determined from the counts in and that is large enough to completely cover the image of the source. However, when aiming to determine the
There is lot of
activity
disturbance.
concentration,
Lot of disturbance is coming. Dr. Kheruka, lot of disturbance
yeah,
is coming. You just see because your voice is cracking.
uh, so
Just see your connection because such a wonderful presentation will not be good there.
oh, my connection is right. I don't know what is the problem. I will try. Now it is okay.
The voice is coming, but it is cracking actually.
Uh, now you just quickly promote testing generally is required.
I think, sir, you can switch off and switch on your video audio settings once again.
So the number of screen per unit of time. The unit of activity is the vector, which is defined one transition per second. The older standard theory is still common use. The goal of quantitative nuclear medicine is to determine the absolute activity in a given volume, that is the patient and organ or a tumor per unit volume, that is kilobacterial per ml, by external measurement of radiation which is emitted by the patient. A single calibration factor, that is CPS per megabecquerel, can be used to convert a number of counts into an activity value regardless of location of the ROI in the image. Now, what is the activity concentration? The activity in a source in air can be accurately determined from an ROI that is large enough to completely cover the image of the source. However, when to determine the activity concentration, that is megabecquerel per ml, a 3D volume tomography modality generally is required. Under certain conditions, measurement can be combined with an additional modality to obtain the volume of the source, that is CT, study of the tumor site, to know the tumor site. Percentage activity. Now, activity uptake expressed as percentage of injected activity in sometime convenient measure. However, it is necessary to measure the residual activities such as syringe and associated tubing after administration and to correct for physical decay. For example, thyroid uptake probe. Nuclear medicine imaging can give information about the functional volume such as ejection fraction in cardiac SPECT, functional volume mostly in cardiac, that is end diastolic and systolic and stroke volume in cardiac imaging, are indirectly estimated through activity measurement, assuming the major single intensity is proportional to the blood volume in the left ventricle cavity. In other words, measuring such volume does not involve actual volume delineation. The accuracy of this functional volume estimate is thus directly which is related to accuracy of activity measurement. In nuclear medicine, imaging also used to give the information about the metabolic activity, for example, in fat or volume with impaired metabolism. Relative cardiac study. In nuclear medicine, sometimes we are using two different modalities to compare the relative function of the organ. For example, you can see this is a technetium MRI scan showing a perfusion defect in the inferior wall of the cardiac, which is not present in case of FVC PET scan. That means it shows that viability still is there in this wall, and this patient can be treated by using the medicine. This is the second example where you can see that occipital lobe in case of dementia with Lewy bodies showing a less metabolic activity compared where we expect it not showing perfusion defect. In temporal, there is in Alzheimer's disease, it is showing a sorry, less metabolic activity in the temporal lobe where in the SPECT it is not showing. In posterior showing a posterior island in case of dementia with heavy bodies in the back, which is not present in the SPECT. So like that, by doing the comparison, we can diagnose the disease. Now, the SUV is defined as the ratio of the tumor uptake, that is kilobacterial per ml, divided by the injection by the dilution of volume, and that is called SUV. And SUV is the dimensionless quantity. It allows to assess the uptake in ROI irrespective of the administrated activity and the patient weight. The use of SUV as a measurement of relative tissues or an uptake facility comparison between patient and has been suggested as a bias for diagnosis. However, the practice of using SUV threshold for diagnosis is not widely accepted. First is that accurate staging and diagnostic information do not have to depend upon the accurate image quantification, since the relative image content, that is image appearance, is often sufficient for such purpose. Second, measured SUV have a large degree of variability due to the physical and biological source of error, as well as inconsistent and non-optimized image acquisition, processing, and analysis. There are three types of SUV, that is FSUV mean, FSUV max, and SUV peak. So these calculated by using this different formula. Normally we are using lean body mass instead of body weight, because of in lean body mass the adipose tissue is not included. So how the SUV is playing a very important role to diagnose the disease. This is the CA breast patient who came in our department with the complaint of headache for the phone. So we performed the scan and we found a lesion in the brain, and simultaneously we found one more lesion in the lung. So you see how this which was unknown. This patient is having this lesion in the lung. So like that, this SUV is playing a very important role to diagnose the disease. Then this is the example where we will see that how the SUV we can use to know the response of therapy. PT trends in a pressure imaging to predict the absorbed dose during therapy treatment plan. Post-therapy imaging we are using to monitoring the rates and dose during therapy to establish correlation between dose response and toxicity. The SUV estimation of individual lesion help determine total tumor pressure concentration and clearance, enabling the assessment of total tumor. This is the example where we administered Lu-DOTATATE 177 to treat the tumor in the liver region, and then we determine the SUV at different time intervals, and we see that after 48 and 72 hours the SUV becomes stable. It shows that the mutation DOTATATE remains in the tumor and delivering the dose there. This is the second example where you can see that pre-MIBG therapy, pre-MIBG therapy, it's showing a SUV values in the lesion is high, and after after MIBG therapy, you can see here the